Sure, I'm Ofer Jacobowitz. So I'm an ENT and sleep specialist at ENT and Allergy Associates. I'm the co-director at Sleep here, and I'm also the chair of the Sleep Disorders Committee at the American Academy of Otolaryngology, Head and Neck Surgery, and the secretary of the World Sleep Society. My practice is focused on sleep disorders and nasal disorders, and in particular, I like to help diagnose and treat obstructive sleep apnea. So sleep apnea is very, very prevalent. In fact, it depends how you define sleep apnea, but certainly it depends on the age. So if you're middle-aged, we can say that like a third of men might have it, and 20% of women may have it. Overall in the population, it could be as high as like 10% of the men and maybe like 5% of the women. So it's extremely common, but it depends on the severity also of how you define it. So everyone's different. There are people that just don't know they have it. They just have the bed partner tell them that they snore loudly and they gasp and they struggle to breathe. And some of those people are not aware that there's a problem because they're sleeping at the time. But others will say that their sleep is disrupted. They're waking up frequently during the night. And other people may say that they're quite sleepy during the day, that it's hard to function, it's hard to concentrate, it's hard to remember. And those are the common, shall we say, symptoms. Now, this can also lead to other problems, of course. If you're sleepy, it can cause mood dysfunction. You may have, accidents in terms of motor vehicles and so on. So there's a variety of symptoms, and sleep apnea affects different people differently. Right. So we need to understand what is sleep apnea, which we didn't discuss. So sleep apnea essentially occurs when the upper airway, the throat, narrows during sleep as muscles relax. As this occurs, there is eventually, in most cases, at each time that the throat narrows, a drop in the oxygen levels, and eventually that obstruction ends as the nervous system activates. That's called an arousal. That arousal, by the way, also triggers constriction of your blood vessels as well as rise in your pulse. So there's an activation of the cardiovascular system that happens at the end of the obstruction. And remember, with sleep apnea, we're talking about obstructions that happen multiple times an hour. It could be 30 times an hour for some people, for example. So there's an abnormal activation of the cardiovascular system, which, by the way, undergoes an incredible restorative phase during sleep. So you miss on that, drop in the blood pressure during sleep and other beneficial effects of sleep on your cardiovascular system. So that's the mechanism. And then we talk about the associations. So when it comes to sleep apnea, there's very strong associations with risk of recurrent arrhythmias like atrial fibrillation. There is association with a higher risk of heart attacks, strokes, and more. And certainly in patients with resistant hypertension, those that are difficult to treat, there's a very high likelihood that they may have sleep apnea. So the first is not to ignore it. And if either I suspect that I may have sleep apnea or my bed partner suspects that I could have sleep apnea, then go have it checked by a doctor. ENT doctors are a good choice because we're able to examine the entire upper airway anatomy where sleep apnea occurs, in addition to obviously asking the right questions. But many other doctors can also provide obviously diagnosis. What you need is a sleep study after the evaluation. So it starts off with just a simple physical evaluation, which includes taking a good look in the mouth and the nose and looking at the whole structure of the face as well. Because sleep apnea can happen in people certainly who are overweight and obese because they have excess soft tissues. The tongue may be bigger, the neck will be wider with the throat being narrower. But sleep apnea also happens in people with a small face. So physical exam in general, looking for obstruction that's obvious in terms of the throat and the nose that's contributory, like large tonsils, for example. And then a sleep study. Sleep studies now are mostly done at home. And in most of the cases, that's sufficient to diagnose sleep apnea. So it's more convenient and also more natural because you sleep in a more comfortable and more normal surrounding. So number one is if there's a suspicion, obviously get it checked. It's it's not difficult, and it could lead to a much better quality of life and reduced medical risk that happens that sleep apnea can carry. Certainly, that's number one. The second thing is make sure you interact with a good clinician that understands that all treatments in medicine need to be personalized. So there isn't like one therapy for one disorder. So for sleep apnea, for example, we have the CPAP air pressure devices, we have mandibular advancement devices, there's reconstructive surgery, there's weight loss, and even implantable neurostimulation. So having a doctor that's versed in the various treatments is important because that's the way to make something work long term by personalizing the treatment to the individual. So don't hesitate to be evaluated. People like myself who are ENT and sleep boarded are I think particularly suited, but there's so many great specialists that can provide help or internist, of course. So just have it checked, of course. So those are my most important recommendations.